हेलो एवरीवन, नमस्ते। आप सभी का मैं वेलकम करती हूँ आज के हमारे इंस्टा लाइव सेशन पे, जिस पे हम बात करने वाले हैं प्रेगनेंसी केयर एंड शेड्यूल। यस, आई एम डॉक्टर सौम्या द्विवेदी, द डायरेक्टर एंड चीफ रेडियोलॉजिस्ट of Qura Diagnostics and Research Center, and I'm very happy to invite one of my friends and a very great doctor, Dr. Rohan Palsetkar. Let me quickly tell something about him. He is MS OBGY FRM and he is the head of unit Bloom IVF Infertility Centers in DY Patil. He is the second joint secretary of AMOGS and joint treasurer of MAGE. He is the managing committee member of MOGS and MSR, and he is also the associate professor at DY Patil School of Medicine. He is a Foxy Korean, Shanti Yadav and Kumud Tamaskar and late Praveen Mehta awardee as well. He is also MOGS Pramila Bhatia Young Scientist Awardee 2021 and MOGS Dhruv Shah Best Committee Member 2020-21, AOFOG Young Gynecologist Award he's been awarded, and Foxy Yuva Orator 2020 and ISAR Yuva Orator 2019. We are so fortunate to have Dr. Rohan with us. Let me quickly join him to this session. Just one second. Dr. Rohan, and very soon we will have him with us. Hi Rohan, how are you?
I'm good, Soumya. I hope my voice is clear and you're able to hear me.
Yes, absolutely. You're all clear from at this side.
Perfect.
All right, so I've just introduced you, and I'm so happy that Dr. Rohan could join at Qura Talks yet again for another mind-boggling session, because I'm sure pregnancy care and schedule patients have so many queries and doubts, and this is a live session, so your all our followers can ask us live whatever they want to ask, because we have a great doctor with us. Dr. Rohan, stage is yours.
Soumya, I think that's so sweet of you. I'm always happy to come on your Insta Live, I think. And I'm so glad we're getting to catch up all the way back from our medical college days when we were in MBA together. So it's really good fun to really catch up with old friends. And the best part is we're able to inseminate some knowledge to the general public as well as our friends as well. So that's one good thing which I really enjoyed. And I really enjoyed this topic that you have taken, which is so close to my heart. I think pregnancy care is something that's taken sometimes a little too lightly and sometimes a little too seriously as well. I think it's important that we find the right balance. For me, I always tell my patients, the point is the 9 months that you're pregnant, you need to enjoy these 9 months. It's not just about stressing with them. See, I'm an infertility specialist and I deal with majority of cases of high-risk pregnancy. Once in a while, even I enjoy when I have a natural pregnancy that comes to me. And so such a nice and smooth 9 months which go through. So for me, I think it's so crucial that we go step by step. Like when we take into consideration, I look at it dividing our pregnancy into 3 months, every 3 months. So our 9 months are divided into 3 trimesters, as we call them. So I do believe that the first trimester begins way before birth itself. So I think it begins with preconceptional care and then it transitions into conception itself. So I think that that's the first thing that we look at in the first trimester. And I think we get a lot of questions saying that, especially when patients are trying to get pregnant, they're asking us, what do I do when I'm looking at pregnancy, when I'm trying to conceive? So I think one thing that's a very common thing that we should be telling them, so that's preconception as well as throughout the pregnancy. I think those are the simple things. Don't drink, don't smoke, don't do any of your recreational drugs as well.
Correct.
That's a very important thing, because in the first 3 months, those are things that are very important. Folic acid supplementation is something that if you are planning a pregnancy, please start off immediately, and also as soon as either you're trying to conceive or once you find out you're pregnant as well.
Right, absolutely. So, God, Rohan, like you just telling us, so I'm sure we all have so many doubts in regards to when should we really start. Like you just said, preconception is the best time to start caring for the fetus you're going to make. So, I have jotted down a few questions which our viewers have asked us on the poll,
Absolutely.
which we posted a week back. So, we've just taken some common ones, and I'm going
Sure.
to shoot all the questions to you because it's the
Rapid
right
fire
time
it
to
is.
let's start. So, what is that most important pregnancy care a couple should keep in mind? What is the most important tip you want to give?
So if I'm looking at the most important pregnancy care, I think is to de-stress. That is
Hmm.
one thing a couple must do. See, because you do have a lot of first time couples who do come and they
Correct.
begin to stress out about the fact, oh, we're pregnant. My wife is vomiting a lot. Another
Yeah.
thing that what we see very commonly in the first trimester is abdominal cramps, which do
Yeah.
occur in pregnancy. Look, abdominal cramps are going to happen. Remember
Hmm.
that your progesterone levels are rising. The progesterone, as we gynecologists say in a joking manner, is something that is called a lazy hormone.
Yeah.
Basically, what it does is it relaxes all the muscles, all
Hmm.
the soft tissues, the ligaments, etc. So it causes a dragging sensation on the uterus.
Correct.
Simultaneously, your uterus is becoming slightly bigger and heavier. So it
Correct.
is going to create a little bit of that pulling or dragging sensation in your lower abdomen. Does
Correct.
not mean that you are going to be this. So that's one thing in your first trimester you must take care of. Remember
Okay.
one thing, if you start bleeding at any point in the first trimester, please rush and go to your doctor. Don't be like, oh, kal subah dekh lenge if there's bleeding or not.
Yeah.
Go as soon as you can. You can't get in touch with your doctor, go to his hospital. Look, we
Correct.
doctors also sleep at times. All
Yes.
right, so sometimes it can happen. So always go to the hospital immediately. Trust me, all our residents, all our staff know how to reach us one way or the other. So if you
Correct.
can't reach us, it's important that you go to the hospital immediately. Someone will be there to take care of you. So these are certain important things in the first 3 months that you need to take care of.
So
Remember
de-stress
also,
and healing. I think these are the two, if summarizing, these are the two things which you need to remember. De-stress, de-stress, de-stress. And if you are bleeding, immediately contact your doctor. So Dr. Rohan, since we're
absolutely.
talking about bleeding, many times patients said that, I conceived and so I spotted and that's normal. That is a myth
Yeah,
which, floats around, especially in Google. So
exactly.
can you address that for us?
So, especially when you get pregnant, there is something known as implantation bleeding. Basically, what is implantation is when the baby sticks to the uterus of the mother. So now,
Yes.
usually there
Yes.
is a change. So basically, if you don't get pregnant, you get your periods.
Right.
So basically when you get pregnant, the
Hmm.
endometrium where the baby sticks is changing from the period endometrium to the pregnant endometrium, to put it in simple words.
Right.
So when
Right.
that conversion is happening, sometimes a little bit of it may get shed off, which may show up as bleeding. That's where
Right.
Somya comes into play. I will call up Somya and I will tell Somya, listen, this patient's having bleeding. She could possibly have implantation bleeding. So please
Hmm.
just take a look at this
Yes.
patient just to ensure to rule out that there's no subchorionic hematoma. I think,
Correct.
Soumya, this is where I want you to explain to all our followers
Yes.
and viewers that what is the subchorionic hematoma?
So basically, when the baby does actually implant inside your endometrium, जो endometrium होता है बच्चेदानी के अंदर, जहाँ baby implant करता है, उसके आसपास आपका जो कोरियोनिक प्लेट एक होती है, उधर एक blood का collection हो जाता है, उसको subchorionic hematoma बोलते हैं, and that we can very well visualize on a transvaginal scan. And everyone should get a transvaginal scan if you are undergoing any abnormal bleeding after you have conceived. So when you go to your gynecologist or your obstetrician, they will suggest you to get a transvaginal scan so that you can find out if there's internal bleeding happening or not. And that's how
I
you
think
can do it.
I think Soumya, that's very important. Because like a lot of patients that I know, sometimes I have the fear of doing a vaginal scan because that can create problems to the baby because we're inserting
Yeah,
something into the vagina.
you
So
are
I'm
you're
sure Soumya,
absolutely right. Yes, and that is
You
one
might
thing
have
which
so
we
many
make
stories.
always. Yes, so many stories in regards to that. There's a very big myth which I want to burst since Dr. Rohan has just told us. Many patients feel that if they get a transvaginal scan, their baby is going to be harmed because the probe is going inside your vagina. But remember, the uterus is very well inside and we're not going anywhere near your baby. It's just the sound waves which are going, which are totally safe. And that's how we interpret the image and not touching the baby per se. So, in fact, not even, before 10 weeks, but even after 10 weeks, around 12, 13 weeks, when we do a detailed anomaly NTNB scan, then also we resort many a times for a transvaginal scan to see high resolution structures for the baby so that we rule out all the abnormalities. So at any point of time, be it at 30 weeks also, if you go ahead, do this internal scan, this transvaginal scan, it's absolutely safe. और नहीं हम आपके baby को touch नहीं कर रहे. So that is very important point which you need to remember and you need to keep in your mind. Even if your in-laws say so, that no internal scans, no. You should be aware that this we are doing for you and your fetus. So yeah. So thank you for addressing that point.
Not just the in-laws, even the parents
Yeah.
themselves. Yeah.
Correct.
An-
Very important,
Another,
especially in Indian
yeah,
scenario. Yes, please go ahead.
yeah. Another misconception that's there is non-veg nahi khana chahiye, garam
Yes,
hota hai पेट,
correct.
especially the first 3 months. So that's
Yes.
another myth. It's
Yeah.
not true. See, in general, in pregnancy, whether you eat vegetables or whether you eat non-vegetarian food, there is going to be a little bit of acidity and nausea, which is a part of your pregnancy. It is
Correct.
expected. In fact, understand that some non-veg foods do help in developing the baby, especially with the protein content that's there
Correct.
in it. Protein is
Correct.
nothing but building blocks. So that's good.
Yes.
But that does not mean you go have a chicken pizza, you have a chicken burger, and all this. It's important that you eat healthily during your
Healthy.
4 months. That does not mean you can eat your burgers and pizzas. There's no harm in it. But don't do
Yeah.
it every day. Doctor ने बोला था आप chicken खा सकते तो रोज chicken burger खाएंगे. No. That can also cause the acidity, but you can have your healthy chicken, घर का chicken which is cooked is very well. One thing what we say to avoid is any raw meats, especially
Yes.
though now Japanese cuisine has become very common in India. So don't eat sushi and all, especially in the pregnancy. Half fry also avoid in your pregnancy. So these are things which you should have fully cooked meals that will be much better and much healthier and more nutritious for your child.
So since we're talking about food, Dr. Rohan, there's also this myth which goes around is seafood should not be eaten. Not only raw meat, but seafood also is said to be
No,
avoided.
no.
Which I feel is totally wrong because it's such high protein and it's so good for the baby. What's your comment on that?
In fact, seafood is one of the most healthiest and nutritious foods that's available. One,
Correct.
it's white meat, so it's
Yes.
healthy for your baby. Two, it's rich in omega fatty acids as well. The only
Yes.
thing is what we do tell patients to take care is make sure that the fish is cooked well and properly. We don't
Yes.
want any uncooked fish to be consumed by a pregnant mother. It's not going
Yes.
to create major harm to the baby, but the last thing I want is my mother, the pregnant woman, to have any diarrhea, have any salmonella, which I don't want the mother to be under stress. That's
Correct.
one thing that we want to ensure that the mother is healthy and eating. So seafood is a total yes from me. Please eat it. Just make sure that it's cooked well and you are eating some fresh seafood. That's about it.
Yes. And also, I would tell our viewers that don't experiment during your pregnancy. If you've not eaten, seafood before and, you are thinking, all right, that's good for my baby. So let's start. No, don't experiment now. Now is not the time. So because seafood sometimes does create allergies, which you will feel that, all right, that's harming my baby. No, but maybe you are allergic to it. So you have to be cautious about all of that. That since whatever you've been eating before, just tune into the healthier version, what Dr. Rohan wants to say. And don't experiment with newer foods also. And seafood is definitely a yes, yes. And non-veg is definitely a yes, yes. So basically, Dr. Rohan, anything high in protein is very good for the baby for muscle building. Is
Absolutely.
that correct?
Absolutely. Listen, now rich in proteins is yes, that's good, but it has to be a balanced diet. We do need our fats. We do need our carbohydrates.
Right.
So no dieting, no keto diets in pregnancy. Okay. So it has to be a well-balanced, nutritious diet. That's the most important thing. Enjoy your dals, enjoy your rice, enjoy your vegetables, enjoy your chicken. It's all good. It's all healthy. It's important. Listen, you can also eat your cakes, pastries, and everything, but all within the limitations, all within their due thing. Just because you're pregnant, this is another myth which I keep telling my mothers. My mothers come to me and say, Doctor, I have lost weight in the first 3 months.
Yes.
Yes, that happens.
Yeah.
That happens. It is going to happen because there's so much nausea. You're not going to be able to eat well. But Dr. Soumya will tell you during the scan, your baby is healthy and doing well. The entire concept of gaining weight during pregnancy is gone now. We are targeting anywhere between 5 kgs to 9 kgs throughout the pregnancy.
Correct.
As long as your baby is growing well, your blood parameters are there, which are well within the limits. I don't care. Trust me, you will thank your gynecologist for not making you put on weight during those 9 months.
Because it's very difficult to shed it off.
I know it is quite a challenge. It is quite a challenge. And see, you can't go on a diet immediately post delivery because of the breastfeeding. So that's another thing that we want to ensure, that you gain weight, but in a healthy manner and not too much weight either.
Correct. So basically now there are nutritionists who you can refer to, and they can give you a proper balanced diet, and you can, target your weight, which is sufficient enough for your baby to grow. So even if, like Dr. Rohan said, even if you're gaining 5 to 6 kgs, and that's good amount of weight gain for the fetus as well, because every time you go for a scan, you can absolutely see that, this much growth of the baby is happening at this much centile on the growth charts. So you do not need to worry that you need to always gain weight, keep gaining weight. So you don't need to worry, but focus on your balanced diet. I think that's the best protocol to follow.
Soumya, now obviously we're still in the first trimester. So I think there are a few important scans which we do need to do in the first trimester.
Yes.
Of course, I prescribe them, but I think you'll be able to give us a lot more detailed reply about it. So can you just shed a little bit of light on that, and then we move to the second trimester?
Perfect. So since we're talking about the first trimester, there are two most important scans that you do not miss. All right. First and foremost is a scan which is early pregnancy scan, which is done before 8 weeks of pregnancy. It can be done anywhere from 6 to 8 weeks, depending on your doctor, whenever you show up to your gynecologist. So that is a fetal viability scan. So you need to see what is viability is. आपके fetus में heartbeat आई है कि नहीं है, आपके embryo में heartbeat आई है कि नहीं, is it at the proper place? So there are not only two, 3 points which we consider, but many things like, is there any ectopic pregnancy or is there any heterotopic? That means kabhi kabhar fetus can be inside the uterus as well as outside. If there is one fetus or multiple fetuses inside, are we dealing with twins or quadruplets or triplets? So a lot of information does get. Also the date of delivery, aside if there's any discrepancy in the growth of the embryo and the last menstrual period date which you provide to your clinician. So many information we can acquire from just a first early pregnancy scan. That is very important. And second, in first trimester, we do an NT-NB scan or a first trimester scan. It can be called with many names, but the most important point why we do this NT-NB scan is that we rule out, they tell us about the aneuploidy markers. What is this aneuploidy markers? आप सबने बहुत commonly ये diseases के बारे में सुना होगा, जिसको बोलते हैं डाउन सिंड्रोम या एडवर्ड्स और पटाउ. एंड in fact 21st March is Down Syndrome Awareness Day. So there are so many problems which are happening at the chromosomal level. So there are few markers which we see in this detailed scan, which is done at 11 weeks to 13 weeks, 6 days. And we see the thickness of the nape of the neck, the nasal bone. many arteries like ductus venosus and tricuspid regurgitation, so on and so forth. And we calculate if there is a high risk category you're falling into of these aneuploidies. So if there is, then obviously you must get a blood test along with it, which will come along in the when we're going to talk about it in detail in the coming few minutes. This scan is also very important and should not be missed. Why? Because we want to rule out around 92% of the congenital problems which the fetus can suffer or acquire. Also, sometimes for preeclampsia, Dr. Rohan, preeclampsia is something which is blood pressure increase हो जाता है because of pregnancy. So उसकी भी screening हम इस time पे ideally कर सकते हैं.
Absolutely.
And we can start the treatment. Dr. Rohan, you can tell about that better, that how the scan can help in controlling the preeclampsia developing in the patient.
So in fact, this is something that we actually do with a conversation with the radiologist. Like when Soumya is doing these scans, I'll actually ask her to look for basically there is something known as a uterine artery which supplies blood to the uterus. So we ask her to do a Doppler study. Basically that through the sonography, we get some findings on the sonography, which Dr. Soumya would measure and tell me what is the resistance in that. Based on the resistance, we understand what is the risk factor for the mother to develop preeclampsia. Preeclampsia is nothing but जब BP बढ़ता है pregnancy में. So ये sonography से हम लोग को पता चलता है कि BP जल्दी सेट होने वाला है या लेट सेट होने वाला है. तो जब हम लोग ये NT स्कैन या NB स्कैन बोलते हैं जो हम लोग करेंगे, उसमें बेसिकली हम लोग को आइडिया मिलता है कि बेबी को डाउन्स, एडवर्ड्स और पटाव सिंड्रोम का क्या रिस्क है जब हम उसको डुअल मार्कर ब्लड टेस्ट जो बोलते हैं वो करते हैं. इसमें दो चीज होते हैं, उसको बोलते हैं पैप ए और बीटा एचसीजी, फ्री बीटा एचसीजी. जब ये दोनों कंबाइन करते हैं तो ऑलमोस्ट 90 to 95% सेंसिटिविटी, मतलब उतना एक्यूरेट है ये डिटेक्ट करने में उसका रिस्क फैक्टर क्या है. अभी और एक टेस्ट आया है जो नया टेस्ट है which is called as NIPT, not really new but almost 7 to 10 years old. But this NIPT test, what now they do is it's more sensitive in detecting Down syndrome, and now it can tell you also about all 23 chromosomes. Of course, the only drawback of this test is it's expensive. Like correct. The cost varies all over India. So I don't want to get into the cost. And unfortunately in India, the thing is that it's not insurance based our practice. The patients do have to bear the cost. Though in Europe and America, I think everyone's pretty much doing it because it's insurance based.
Now
so
it's protocol over there.
So it's pretty much done for every patient over there. So at least what I do is that I give the patient the option. Irrespective of whether they can afford it, not afford it. I think that's not our decision to make. I think it's important that we offer it to every patient and then they can take a decision on that. So I think through the NT scan, through the dual marker blood test, through NIPT, through uterine artery Dopplers, we get a very good idea about what is the risk factor for these patients for developing Downs, Edwards, Patau syndrome, and also for realizing कि pre-eclampsia यानी BP जब pregnancy में बढ़ता है mother को कितना risk है. So I think these are few things.
And Dr. Rohan just said that since we can calculate कितना risk है, there is medicine also available which can control
Absolutely.
These
so when
the mother is in safe range and the fetus is in safe range.
In fact, one of the medicines what we use is something known as aspirin. So that is something that we do start off on. Being a patient, being an infertility specialist and a high-risk obstetrician, most of my patients are already on aspirin from an early date. But those who have conceived naturally, I wouldn't start them on aspirin. But if your scan came and told me that this, I would start aspirin as well as high-dose calcium. These are two things which are shown to delay the onset of preeclampsia. Very difficult to prevent it, but at least try and delay it as much as we can. So I think that's something that we can do. So Soumya, tell me one thing. I think we've already discussed about this, about the blood tests and Down syndrome. Do you believe in something called an early anomaly scan at 16 weeks? Do you think that it's necessary in the second trimester, or do you believe that we do a direct detailed scan?
So, especially in high-risk pregnancies, Rohan, early anomaly scan is referred many a times, even in our scenario. So, something like a couple is having bad obstetric history, multiple miscarriages before, and they want to find out whether the fetus will have to go through an invasive procedure. So, to give that margin of error, an early anomaly scan at around 16, 17 weeks is sometimes advised. So, in only those cases. However, there is this myth that anomaly scan can only be done till 22 weeks. It's just a sonography where we do all the details. We see all the details of all the organs. It can be best seen till 22 weeks, best. But however, I do anomaly scans also at 34 weeks also, especially if there's a congenital anomaly and the couple has come from the peripherals and they've not gotten any scans done before, and we found a corpus callosal agenesis at 34 weeks. So we do resort to an anomaly scan then also. Likewise, an early anomaly scan can also be done, especially in high risk pregnancies. So yeah, that can be done.
Absolutely, Soumya, and I think that's such an important thing because we've seen so many patients miss out on an anomaly scan. So that is another important milestone in your sonography markers, that and you do not miss out on the first early fetal viability scan. You don't miss out on the NT scan, and you definitely don't miss out on this anomaly scan, which is generally done between 18 to 20 weeks, but can be done even up to 22 weeks, which will give us a very good detailed idea about the baby. All right. So this second trimester, I'm sorry, the second trimester is when we start our iron, calcium, and protein powder as well. So this is where we look at the preconceptional care, where the hemoglobin is something that we need to manage. So we do start iron tablets. We don't advise to start them in the first trimester because that's when the organs are being produced. So in the second trimester is when we do begin the iron tablets, calcium tablets, and the protein powder. So, and see, sometimes a lot of our patients say that protein powder they're not very happy with because we tell them to mix it with milk, and a lot of women may have an aversion to milk. So if you do eat eggs, another alternative is maybe eat 2 eggs or 3 eggs a day. That should give you your protein requirement enough for the entire day as well.
Yes, correct. So that's a very important tip, I feel, Dr. Rohan. Now let me just shoot you the other question, which I feel is very important, especially for the Indian scenario, that what is the husband's role in caring for the fetus and the mother? I think that's something which is so unaddressed in India. I want you to throw some light on that.
In fact, I think it's such an important factor. When we look at it, I'm telling you, forget about me being a gynecologist. So I was very involved, obviously, in my wife's pregnancy. But when I do look at this during a normal pregnancy where the husband's not there, I think it's very important that the husband for every consult with the wife, because they both need to understand what she's going through. Because sometimes what happens is, it can happen that the woman may forget to inform the husband that, oh, the doc said to do this. What the husband's role happens is that he's there. There are two people being attentive. Secondly, especially speaking to the child when the child is there inside the abdomen. So I do believe in this concept of Garbh Sanskar. So the entire concept of Garbh Sanskar is that when you're speaking to the fetus while the baby is inside the tummy, there is apparently some good vibes that go to the child. So it's something that I believe in. I'm not going to say that it's scientifically proven, but there are theories behind it. So I do believe, and I say that there's no harm, as long as you're not doing any harm to the baby, I think it's fine. So that's another thing. Another thing is, it's important for the father to be involved in the nutrition of the mother. Ensure that she's taking her prenatal antenatal vitamins. She's taking adequate nutrition. She's taking her iron and calcium tablets. Ensuring that she gets a massage from him during the pregnancy as well. So that is something that's very important. It's important also for the husband to give emotional support to the mother, because the woman is going through a lot of hormonal changes. So it is going to happen that sometimes a woman may break down just for nothing. She may just tear up. So at that time, she doesn't want anything but just for a husband to listen. So
Yeah.
emotional support, physical support, and mental support are three very important things what a husband must play a role in a woman's life.
Correct.
Whether that happens or not is a different issue, but these are three things that need to be done by a husband during a pregnancy for sure.
Correct, correct. Very, very important tip. And the connection is all they have. You know, the husband's role is connection with the fetus and the mother during that time, during the pregnancy as well as just after the delivery also. Because we are hearing a lot of stories these days of postpartum depression as well. And
Oh
I
yeah.
feel that's a very major role where the couples, the husbands come into picture, and when they support and be that's a miraculous discovery altogether, to grow
It is
together.
honestly that a man is practically not useful when I look at it post delivery for the child, in terms that the main thing is the breastfeeding which the mother does. So at
Yes.
that point the husband plays a major role in supporting, because the mother is waking up every 2 hours, 3 hours, she's tired. So what's important is you give that emotional and physical and mental support to the mother during that time. Pitch in by changing the diapers if the baby wakes up crying. Just for that, let your wife sleep. These things are extremely important.
And believe me, your wife will remember you forever on this if you support during this time. It's the
Or
most.
curse you forever.
Yeah. All right, let's switch ahead.
Yes.
Rohan, according to you, how many times a couple should visit obstetrician in regards when they are conceiving? So,
So
how many times? What are the
so
important visits per se?
when I look at it, at least a minimum of 3 times during the entire pregnancy, at least once in
Okay.
every trimester. But what I believe is you should visit your gynecologist once at least in the first trimester, at least a minimum of 2 or 3 times in the second trimester, in the third trimester, like post 26 weeks, till you reach your 30th week, or as you say, satwa ya atwa mahina,
Yeah.
at least once a month at that time. Once you reach your 8th month, या 8वां महीना पहुंचे, every 2 or 3 weeks to ensure the blood pressure check is there, because that's what we're majorly
Yeah.
worried. And in the last 1 month, जब 9वां महीना लगता है, at
Mhm.
least once a week, so that you can have your physical checkups, ensure that baby's head has come down, get a
Yeah.
vaginal checkup, because we would want to see that there's adequate space for the baby to deliver normally. These are
Correct.
things that need to be taken into account as well.
Okay.
So
So,
a minimum of 3 months, a maximum of how comfortable you and your gynecologist are meeting
hmm.
each other. I generally do it once a month for in
Hmm.
every trimester, being a high risk obstetrician, and in
Correct.
the final month, in the last 2 months, it's every 2 weeks and then every 1 week.
Right, correct. So, Rohan, now let's switch. Since you talked about third trimester, let's switch to the third trimester. In third trimester, what are the tips you can give to a couple so that they know they are doing their best to protect their baby? What
So,
can they do?
so again, another thing is that you need to use your nutrition adequately. Another misconception is you're pregnant, don't exercise.
Yeah,
Absolutely wrong. Absolutely wrong. During your second and third trimester, please walk around, do prenatal yoga classes, go for your Lamaze classes, because all your exercise, your yoga, and everything is
yes,
going to help you deliver normally. Because all
yes,
your yoga exercises, your antenatal exercises are going to loosen up your hip muscles, increase your space for you to deliver, relax your muscles, give you the ability during normal delivery to increase the space for your baby to deliver normally. So these are things which are very important. Also
correct,
understand, you need to understand your limitations. If
yes,
you are someone who's been exercising regularly before your pregnancy, you need to understand that, madam, you cannot jump around to what you used to
yeah,
before. You
yeah,
need to understand that you do have a baby inside. Do simple yoga exercise. If you're walking, maybe every 20 minutes, please do sit down.
yeah,
Do take a break and
yeah.
resume again. There's no problem. But understand the limitations of your pregnancy. Don't go beyond the point, and always consult your gynecologist to whether you can exercise or not.
Yes, because if
That's
there are
another.
things you're going through and you're taking treatment for, and then you resort to over exercising, that can also be troublesome. So consult your gynecologist for what kind of exercise regimen you can follow or what is best suited for you. Like Dr. Rohan said, exercises are very important. So any form of cardio, he means to say, Dr. Rohan, what do you think? Around 20 to 30 minutes is good enough?
Yes,
Good cardio
absolutely.
to
20
follow?
to 30 minutes is adequate and more than enough.
Right. And what are the other tips? For example, many a times we think, even in our medically, we see that eighth month is a month where things switch drastically for a
They
fetus
do.
in the womb. So,
They
what are the tips you can tell a couple that they can observe that they should report to their doctor immediately?
So a few things what you do need to look at, especially, is look at the swelling in your feet. That's
Okay.
something that's very common. Look at how
Right.
much weight gain you're having during that trimester, because you don't want to gain more than 500 to 600 grams a week if that's
Okay.
happening. If you're
Okay.
increasing more than 1 kg per week or more than 4.5 kgs per
Hmm.
month, you
Hmm.
need to go meet your doctor, because that's the first sign that's going to happen when your blood pressure is rising. Another
Yes.
thing is you're going to start feeling your your baby starting to kick at around 20 to 22 weeks.
Hmm.
You have to see whether your baby's movements have reduced. That's another sign that you need to be careful about.
Right.
Another thing is that you need to do a few blood tests which your gynecologist will advise, because at that 30 to 32 week mark, मतलब आपका 7वां से 8वां महीना, is when your
Yes.
hemoglobin is going to drop drastically if you're not taking adequate iron supplements. So
Correct.
that's another thing that you need to be aware of.
Correct.
Another thing, at this point, your radiologist and your gynecologist is going to tell you in what position your baby is. Is it
Yes.
straight? Is the head down? Is the buttocks down? Usually at this point, you're going to understand whether you are going to be able to do a normal delivery or a cesarean section as well. That's
Correct.
another thing. One thing I forgot to mention is you have to check your blood sugars in all 3 trimesters.
Very
In the
important.
first 3 months, the second 3 months, and the last 3 months, to understand if you're diabetic or not. But that's
Yes.
another common thing in Indian women. In fact,
Yes.
Indian women have a 10 times more chance of developing diabetes in pregnancy, especially it's called gestational diabetes. So these
Mhm.
are things also we need to take a look out. Obviously, once again, the advice I gave you in the first trimester: proper nutrition, proper exercise, and proper rest are 3 things which you do need to take into account, especially in the third trimester as well.
Very important tips, I feel. And Dr. Rohan, since you were just talking about movements, many a times, non-medicos are very concerned that what is this adequate amount of movement? How many movements my baby should do in my final trimester so that I feel everything is okay? Or my baby didn't do movement half a day. What should I do? They panic during that time.
Yeah.
What is that one thing you want to talk about that, please?
So understand one thing first. A baby sleeps 20 hours a day. Okay?
Very
The
important to remember. Remember this.
Remember, your baby sleeping inside your abdomen 20 hours a day. It's when you eat food, your baby gets the energy to do your kicks and all. So generally what we say is, if you're counting how many times the baby is kicking, for
Yeah.
2 hours after you eat your major meals, like your breakfast, lunch, and dinner, count how
Hmm.
many times the baby kicks. Usually in a day, you should be able to feel about 9 to 10 kicks or movements during the entire day. So if you have
Okay.
too little movements, at that point you need to go and visit your gynecologist, who's going to basically refer you to Soumya to say, Soumya, please check the heart rate of the baby. I know this is a very age-old thing where people, I think, have moved on, but something known as a biophysical profile, that's something what we used to do in the past. I think we moved on or done a modified one right now, right, Soumya? I
Yeah.
think,
Yeah.
can you just give a little bit of details about that now?
Yeah, so basically, what we do in the final trimester is a color Doppler scan, and in that we see basically how much blood flow the fetus is getting from the mother, or is there any U2 placental insufficiency, as we call it medically. That means there's any restriction of the blood flow going to the baby, and that can, your obstetrician can intervene at that point and give you medications, or plan your delivery accordingly depending on which week you're going through. So it's very important when you feel there's any movement, less movements, or you have swelling and all of that. go to your obstetrician and then get yourself a color Doppler scan so that you have all the information with you. And with that color Doppler scan, you can actually predict that, all right, you have another 2 to 3 weeks in your hand, which is safe. Even when, you know, the blood flow is insufficient, you can buy time and grow the baby with medications also. And finally, deliver, you know, and reduce the perinatal morbidity and mortality. So that's a very important scan, which is done after 8 months. So anytime after 8 months, you can get that scan done.
Absolutely. I think, Soumya, that's something that's very important.
Yes.
And that's something that we all do right now during our practice as well. In fact, I started doing Dopplers at starting from 26 weeks or 28 weeks itself, because again, being a high risk obstetrician, that's something that has been there for me since a long time. So I think during the third trimester, another thing that we do need to explain to the mothers is that you're going to feel a little bit of, again, bladder pressure. You're going to feel like you're urinating a lot. So that does not mean you stop drinking water, because that's something that I've again seen commonly with women, that I have to keep going to the bathroom. What you have to understand is you're more prone for urine infections at this point. So please, even though you feel like going to the washroom every time, drink at least a minimum of 2 to 3 liters of water per day. Please measure it. Don't be like, I'm drinking enough water. No, you're not. Especially when you think you're drinking enough water, that means you're drinking barely 1 liter of water per day. So please keep a bottle with you which keeps measurement. Drink your coconut water, drink your juices. It's absolutely safe. There's nothing to be worried about.
Correct. So I think, Dr. Rohan, a lot of great tips you've given to our viewers today, and I hope many doubts have been cleared. So if there's any question, you can DM us also, and we'll be happy to answer them. So let's wind up, Dr. Rohan. I think I've taken a lot of time. So thank you so much again for being a part of Qura Talks. It's always a pleasure to have you with us. So thank you so much again, Dr. Rohan.
Thank you so much, Soumya. It's always a pleasure to be here, and in fact, I even log in for your other talks to listen up to them, because they do give so much vital information. We are doctors, but there are certain things that even we don't remember and we've not heard of. So it gives us so much insight into it. So thank you, Soumya, for being so informative for everyone.
Thank you so much, Doctor. Thank you, Rohan. Thank you so much.
Take care, Soumya. Really nice seeing you. Take care. Bye-bye.